Now, Ramanuj.
At the outset, I would like to thank AIOS and UKSS for the opportunity. So I'll be presenting our original work on post-COVID endogenous endophthalmitis, which we published in the last year in Indian Journal of Ophthalmology. So various ophthalmic features involving anterior and posterior segments, optic nerve and orbit have been described in COVID-19. So our purpose was to describe the series of endogenous endophthalmitis following post-COVID-19 from a tertiary multispecialty institute. So, a retrospective chart review, including all consecutive cases with endogenous endophthalmitis following RT-PCR confirmed COVID-19 from July 20 to June 21 was done. We got the institutional ethics committee approval, demographic characteristics, comorbid illness, preoperative characteristics, comprehensive ocular evaluation, all were done. Systemic evaluation by physicians were noted and appropriate lab and radiological investigations were noted. Patients with clinically suspected endogenous endophthalmitis were initially treated with vitreous tap and intravitreal vancomycin, either amphotericin or voriconazole. And systemically fit patients who did not respond to intravitreal injections after 48 hours were subjected to PPV and repeat intravitreal injection. Diagnosis of confirmed fungal etiology was based on microbiologically proven fungal elements from the vitreous aspirate. The outcome measures included the visual recovery and control or resolution of intraocular inflammation. So this is the first patient. In the left panel we can see hypopyon, and the B shows a dense vitreous exudate, and post vitrectomy the patient's media improved significantly. The second panel, second column showed there is a infiltrate, retinal infiltrate in the nasal hub and mid peripheral granular infiltrate, and following multiple intravitreal injections that resolved well. This patient also had suffered from severe COVID pneumonia and turned into a steroid induced diabetes mellitus, also had bilateral brain tuberculoma and cavitary lung lesions. She also had history of pulmonary TB at past. We treated also with systemic antifungals. The second patient is a 63-year-old lady who had moderate COVID, treated with steroid elsewhere, turned steroid-induced diabetes mellitus. She also had right-sided hydronephrosis. So both eye received intravitreal injections followed by both eye pars plana vitrectomy. Also received systemic voriconazole, but she developed voriconazole-induced hallucination. So she was shifted to oral ketoconazole, and at the final follow-up, her vision improved and the anatomical integrity was also there. The third patient was a 48-year-old lady who suffered from mild COVID, no prior comorbidities. The right eye received intravitreal injection. We can see multiple fluff balls in the vitreous cavity. Intraoperatively, a subretinal abscess was also noted, and the vision was also improved marginally after surgery. The fourth case is a 45-year-old lady. She suffered from a severe COVID pneumonia, received IV steroid, had a prolonged ICU stay, also developed pulmonary hypertension. The HRCT chest showed post-COVID sequelae with fungal infection, and the bronchoalveolar lavage showed septate hyphae with acute angle branching. These are the focal retinal infiltrates protruding into vitreous cavity. These are bedside images with the 20 diopter lenses, and following intravitreal injections, they undergo organization. So these are in nutshell the range of the COVID, prior COVID ranged from mild to severe illness. Two patients had steroid-induced diabetes mellitus, and some of the patients were treated with, almost all of the patients, 3 patients were treated with steroid previously, and time since COVID varied from 3 weeks to 8 weeks. And the present, all of these patients were treated with intravitreal injections, and 3 patients were treated with pars plana vitrectomy also. So coming to the literature, we can see that in the literature, post-COVID endogenous endophthalmitis have been described by few authors from India and abroad. The eyes varied from approximately 3 eyes to 10 eyes in the literature. Most of the Indian studies have reported fungal endogenous endophthalmitis in the form of Candida and Aspergillus, whether the outside studies have also reported bacterial endogenous endophthalmitis in the form of Klebsiella, Strenotrophomonas, and MRSA. So in conclusion, high index of suspicion is required for patients receiving prolonged systemic corticosteroid following COVID-19. Bedside fundus evaluation needs to be encouraged. Timely systemic and intravitreal antimicrobial agents plus PPV is essential for favorable outcome. Vigilance is required for uncommon but possible drug-induced side effects like voriconazole-induced transient hallucination. Meticulous history, detailed systemic evaluation, appropriate investigations, and a prompt multidisciplinary approach are important for achieving a favorable outcome. So this endogenous endophthalmitis is not only important for post-COVID, but also being in a tertiary institute, I see a lot of endogenous. In recent times also post-dengue, we also see a lot of these patients. So these patients do not only lose vision from the disease itself, but due to some treatment after the primary illness. Thank you. Yes, I have lot of publications, but according to the criteria, I thought this is about a single publication, so I did not mention any one of them.
What are your awards? Can you
Yeah,
tell
I
us?
can tell I have overall 85 publications, and overall I have around 350 citations. My H index is 9, and of the in the last 1 year I have published almost 20 articles, and all of them in the PubMed indexed journals. So I am in a postgraduate teaching institute. So I am the guide for 5 postgraduate students and also co-guide for the DM students, and I am also regularly participating in various national and international conferences as a faculty. But for sake of presentation, I thought this was about a single according to the criteria. So I was not in.
Any awards you won in the
So I got the Oration Award in Kolkata, one Oration Award, and I got a one Best Surgical Video Award in the Winter DOS. These are the recent.
any international?
No, I attended international, but there is no international award within
As a
one.
faculty, have you which
Yes, I awarded. Went to the South Bhutan International Faculty Presentation this year only.
what was the topic?
My topic was retained intraocular foreign bodies case-based practical approach.
Thank you.
Thank you.